After weeks of media fear-mongering over the threat of Ebola in the United States, it looks like the U.S. public is finally starting to turn around and beginning to support the U.S. government's handling of that crisis and handling of what could have been an outbreak in the United States. We're down right now, at least as we are airing this, to one person with a confirmed case of Ebola. That's Craig Spencer, who's being held in Bellevue Hospital in New York City. But we do have a CNN ORC poll showing the level of support of the American people. Let's get some of those numbers. 54% of those surveyed said the government had done a good job in handling the virus, while 71% were confident the government could prevent a widespread outbreak. Now, if you jump back just 2 weeks to a little bit more towards the beginning of at least the American phase of the Ebola response, a Washington Post poll conducted exactly 2 weeks ago, 43% believed they or a family member could contract the virus. In the CNN poll, however, only 7% believed that likely to happen. The actual number is probably something like 0.001% chance. But 7%, that is an improvement, and I'll take it.
Yeah, I'm proud of America. Good. That means that the fear-mongering hasn't got to the majority of people in the country.
Well, what that means is that only 30% of the people watch Fox News or read Drudge Report. That's what that means.
Yeah.
And the other 71% of the people don't read Drudge Report and don't watch Fox News.
Exactly.
Or listen to Rush Limbaugh or whatever.
It shows that when people actually hear things, they'll say it. And even people that are saying it in their homes, they're not politicians, they're not talkers. They say it just because they heard it, and they don't really believe what they're saying.
Yeah.
If you really thought things that were said, President Obama is inviting Ebola into our country. You know, he wants to kill us all. He wants to kill the military. He wants to bring it in. He's happy to see it come. He wants to destroy America. If you really thought that, you wouldn't be sitting on your ass watching Family Guy and Ellen and whatever the hell else you watch all day and Judge Judy if you really thought shit was coming to your front door. If you really believed it, you would do something about it.
Yes.
At least something to protect yourself.
You'd
Instead you just
become
go,
a doomsday
this
prepper.
fucking Obama,
Build
and you
your
sit there.
bunker
Nobody
and-
does that.
I'm glad, but the good thing, I have to give a tip of the hat to the right wing. They did not try to politicize it.
They took the high road in this case.
Rick Perry called into the Jimmy Dore Show this week.
Oh, that's a
And
big
can
get.
And it is. He calls in a lot, and he's got his southern border open for me, if you know what I mean.
Oh my God.
And I'll be Rick Perry, you be me, and you say, Governor, did you agree with how Barack Obama handled the Ebola?
Okay, Governor Rick Perry, do you agree with the way the president has handled Ebola?
Absolutely not. What did he do?
It's pretty good. I like
Thank
it.
you.
Yeah.
Thank you very much.
So the polls are changing a little bit. I mean, we'll see. If a couple of cases pop up in a few other cities, you might see those numbers of the fear numbers spike back up. Right now, it's looking good, though. And understand that we're coming out of a tense situation with how we should handle.
Literally a tent situation in
There
New
are some
Jersey, am I
tents.
right? It's a tent situation.
So in those tents, though, you had Chris Christie. He probably didn't actually go to the location, but he was managing New Jersey's response to Ebola, and he wanted to have this mandatory 21-day quarantine for aid workers returning from Ebola-afflicted countries in West Africa. Now, he has let go the first nurse who was being held under that. He says he'll continue it, so that's what's happening in New Jersey, but the CDC is announcing less stringent but updated regulations in terms of how these high-risk Ebola workers should be handled when they return to the U.S. And we have some of the details here. Only individuals known to have direct exposure to the disease, such as a family member who cared for an Ebola patient without protective gear, are told to remain home under the new CDC recommendations. Health workers are only required to self-isolate if they had direct exposure. For example, if a needle stick punctured their protective gear, or if contaminated fluids accidentally splashed into their eyes or mouth. Wow, that's horrible. Most returning doctors and nurses would undergo twice daily active monitoring, including at least once in person. If those individuals wish to travel, they would have to consult with local and state health agencies, which would then evaluate their specific level of exposure. And the individuals might also be subject to a do not board order for air travel, restrictions on using public transportation or attending public gatherings, depending on their risk level. The interesting thing, by the way, about these new regulations is that under even these more stringent regulations, Craig Spencer, the doctor who currently has Ebola, would have been able to maintain the sort of quarantine he was conducting on himself anyway.
You know, so the more I read about Craig Spencer and the way that that all went down, everything went the way that it should have gone, right? So the initial report that he had contracted Ebola, of course, led to a lot of panic. I fell for the panic. I fell for the paranoia, right? But he did exactly what a healthcare provider or a healthcare worker should do. As soon as he was symptomatic, he was like, oh, time to alert authorities about it, and now he's quarantined, right?
Yeah.
I mean, if you're not symptomatic, you're not contagious, right? So,
And even if you are symptomatic, unless you're throwing up or shitting on someone, they're not
Right.
going to catch it.
right.
Right? Am I wrong about this?
The thing is,
You're
if
a
someone,
doctor.
The thing I feel I also don't want to downplay how contagious it could be if you are symptomatic. So if someone sneezes on your face and they have Ebola, you could get Ebola,
Yeah.
right? As long as it goes through your eyes or your nose or your mouth, any direct contact with the bodily fluids could lead to you contracting the virus. So I also don't want to downplay that. But nonetheless, if you're not symptomatic, you are not contagious.
Yeah. I would say though, just to be safe, until the current outbreaks both in America and Africa go away, don't vomit or shit on anyone.
Yes.
Just to be extra
Until
safe.
then.